My name is Joanne Pong, and I'm a chronic pain specialist PT on manual physical therapy. We specialize in chronic pain. One of the topics that keeps popping up, so that I decided that that is going to be what I'm going to discuss today, is the fact that people are confused when they have an x-ray because they have a hip problem. The x-ray usually shows bone on bone. And doctor says, well, you're bone on bone, so you need surgery. And some people are confused. Is it really time for surgery or can I put it off? Is there something else I can do? And that is what today's video is about. It's to answer and give you some clarity to the question of, is it time to do a hip replacement or is it not, or is it even necessary? Before we get into that, I have to define, is your symptom even reflecting the bone on bone that the x-ray is showing? Because a lot of times it's not. So I have here Emily. So I would like you to stand right there, maybe on my right. Okay. So I'm forward a tiny bit. Very good. So when you think that you have bone on bone, and that is the reason why you're having pain, it's very important to understand where the pain should be if you have a true hip arthritis. So if you have bone on bone, the pain should be in the groin because people don't realize that the hip joint is actually right here. This is not your hip joint, although people think that it is. So how you have this thigh bone, right? And then once you get up to the top, there's actually a neck. And so the bone or the ball actually goes in this direction right here. So that's why if you have bone on bone, you should feel it right here. So a growing pain could be a true hip problem. Now, what if you have pain right around here and it goes all the way to, what if you have pain going down here? I'm going to move that chair over so you can see. So if you have a problem right here, it does not necessarily mean that you have a nerve problem because this is your IT band. It starts from here and it goes all the way down here. So if you have some problem here, that could very well be an IT band tightness. Now, if you have pain right about here, off to the side or slightly more to the back, then there is a chance that you have bursitis. So because this, if you feel the bony part here, and the best way to do that is to actually press the whole palm and you'll feel the bony part. And that is what we call the trochanter. And there is a bursa on top of that. And the T-band goes over it. So what is the purpose of the bursa? The bursa is literally like a Mentos candy. It's sort of like a cushion. It's really what it is. And what the purpose of that is that it stops the rough bone from tearing the structure that passes through it. So it's a cushion that reduces the friction. But if the IT band becomes tight, then it will continually compress on the bursa to the point that the bursa gets irritated and inflamed. That's why it's called bursitis. Anytime you see an ITIS at the end, that typically means inflammation. It's just like arthritis. Arth means bony part or joint, and then itis, that means the joint is inflamed. So some people would have pain somewhere more towards the back, the buttock area. So that could be like the piriformis being tight, or it could be that you have a glute med tear, all right? Because the glute med sits right about here and it tugs at the attachment right here. So those are possibilities. So when you say you have a hip pain, I want you to learn how to identify which one is a true hip bone problem that warrants surgery. So just remember, it should be right here. So if you have any pain in this area, if I'm in your shoes, I would not, even if you have bone on bone, I wouldn't do it. That is a huge thing for me to say, but I've been doing this for so long that I know that those are other issues. Now, sometimes people get confused because they go to a hip doctor and the doctor says, well, it's not your hip, it's your back. And so they are sent to a back doctor and they see a back doctor and the back doctor says, it's not your back, it's your hip, right? My take on it, it's both. Because if you turn around, so there are so many muscles here that affect the spine. And there are muscles literally that attach here, that start here, that crosses your low back. So they share muscles. So if they share muscles, then both of them are a problem. The other thing that I want to point out, although this is deviating from the hip, but anytime you have an L5-S1, this is L5-S1 right here. If you have an L5-S1 herniated disc, but your pain is literally just here in the buttock, then that means you don't have an impingement. Because if that L5-S1 gets impinged, you should have pain down your lower leg. So yes, you may have a problem of a bulging disc, but if your pain is localized here, then very likely, in spite of the fact that you have this, your problem is something else, which is good news because that means you don't need surgery. And the bottom line is always to consider that the diagnosis is not surgery, that the diagnosis does not need surgery. Okay, because as far as I'm concerned, surgery should be a last resort. People sometimes think that it is a quick fix. And that it will fix everything. I've witnessed so many consultations of patients finalizing hip surgery with a hip surgeon. And what I find very sad is that you hear this 2 months after your surgery, you should be playing golf or you should be good to go. They never talk about what could possibly go wrong, which could be, for example, there is a risk that even after hip surgery, you're going to have more pain, or you can still have the same pain that you have, which means it wasn't really the hip joint that was giving you problems. So that's why I always say it should be the last resort. So anyway, now that you understand the different parts of a hip problem, that it's not necessarily your bone and bone, I want you to understand what could be the problem so that you know how to fix it. So for example, if your hip is actually shifted over to the side, just like that, and an easy way to know that your hip is shifted over to the side is you notice that the gap here is smaller and the gap there is bigger. So that clearly tells you that your hip is shifted, right? So picture this, that you have a hip pain and that it is bursitis. And because of that, you feel like, oh, my IT band is always tight, right? Now, I understand the feeling, there's tightness, but it's not tight because it's tight. It's actually tight because the IT band is overstretched. So for a situation like this, if you are going to stretch the IT band in hopes of improving your bursitis, it's not going to happen. You're not going to get good results because you are not really correcting the root cause of the problem, right? Because you can see how it's overstretched. So the key to having a problem like this is to actually work on stretching the opposite side so that the hip will go back to neutral. So when the hip goes back to neutral, you're going to notice that because these are going to become equal, just like that. All right. So now I'm going to talk about one of the biggest problems when people have pain in their hip, which is they can't sleep on that side, right? So they always say, I can't lay on that side. I got to go on the other side. So if you have a problem like that, there is a good chance that your hip is shifted. So go ahead and shift to the left, for example. Shift, not rotate. So shift over, like you shift. Sideways, sorry. There you go. So imagine this is you, and you want to lay on your left side. So you're going to lay on this side. So imagine that Emily is laying on her side right now. So the bed is here. So if she is laying on that side, guess what? She is putting more pressure on this side. Now, there's another reason that we need to look at, which is about the question of, is the hip rotated this way or is it rotated that way? I hope that you can see it against black. So a lot of times when your hip is shifted, you also have a bit of rotation. So if the body, for example, is shifted and then it is rotated to the right, and how do you know that it's rotated to the right? There are two ways of looking at that. One of them is if you march in place. And typically, if the pelvis is rotated to the right foot should be turned slightly out, just like that. So, because when the pelvis obviously goes in this way, then obviously the feet are going to go with it. Now, there are situations when it's the opposite, but we're not going to go into that. So when you are in this position, right, hip is shifted, and then pelvis is rotated to the right. Now, can you picture that when you are laying on your side, the body actually wants, this top leg is going to want to fall forward, right? That's what you do. When you sleep, the leg actually falls forward like this. So that means the pelvis actually wants to rotate to the left. It wants to do that. That's how the body is designed to do it. But if you are like Emily, whose pelvis is actually going the other direction, when you lay on your side, your body is not capable of what the body wants to do in order to lay on the left side. So that's why it hurts. Because the body is trying to correct it. It wants to go this way, but your pelvis is going that direction. I hope it's not that confusing to you, because this is very critical for people to understand this. Typically, when you're having pain, when you're sleeping, I always look at it from that perspective. Are you even capable of being on your left side or being on the right side? Now, there's another point that I want to make, which is if the pelvis shifts to the left again, the pelvis shifting this way, shift this way towards me, you got it, right? So imagine you're like that, and you want to lay on your right side. It's a picture that we're doing the opposite. She's going to lay on her right side. So if she wants to do that, gravity is going to try to drop the hip in this direction, right? That's what happens. So if the gravity wants to drop the hip in this direction, and the body is actually not capable of that, then of course it's also going to hurt. All right, now relax. Now, if you're one of those people who actually toss and turn when you're sleeping, it just seems like you can't get in a comfortable position. Typically, a person like that has a body that's kind of twisting. We call it a spiral line problem, or can you picture a DNA? So how does it look like? So come forward. So that means that very likely your rib cage is slightly rotated to the right. For example, it could go either way, right? So if the rib cage is rotated to the right, and then the pelvis is actually rotated to the left, all right? So there's a twist right here. And that twist can actually go down all the way to the feet, and then it also goes down to the head, to the neck. So people like that tends to want to go in this direction, or they'd like to bend. There's a slight bend and then a slight rotation. So that's a giveaway that you're having this problem. But anyway, sorry. So if you are in this position, and the question is, how do you know that you're rotated, right? Look in the mirror and look at this area, and you will typically see that one side is closer to the mirror, just like this side is closer than this one. And it can be so subtle. The other way of, you notice that because she's turning, now all of a sudden this is higher than this one. So that is another giveaway. Okay, so when you're in this position and then the other one is going this way, so imagine now she wants to sleep on her side, okay, or even on her back. If she wants to sleep on her back, the gravity is going to try to correct that, right? And she's not capable. No wonder you're uncomfortable, and so you try to go on your side, right? So if you're going on your side, and for example, we're gonna again make her rotate that way, and this one is going that way. So in this presentation, her pelvic area is actually capable of laying on her left side, right? But her upper body is not capable of it, because in order for you to lay on your left side, the body wants to go forward. You see that? You want to go this way. But if your body is going that way, so if I go this way, it's not going to be comfortable. So now I want to flip to the other side. So now you're going to picture that she's going to flip to the other side. Now on the other side, the upper body is actually comfortable because it's capable of sleeping on the right side. But remember that the pelvis is going to the left side. And in order to lay on the right side, the body needs to go in that direction. So then the pelvis is not capable of that position, and that is why people toss and turn. So the other thing I want to point out is, if go ahead and sit down there. So one of the things that you're going to notice is with a hip problem, let's say you have a, what do you call this? You have an IT band problem on the right side, for example. So it's easy to say, I have an IT band problem on the right side. The question you should be asking yourself is, why is your IT band problem on the right? Why is it not on the left? Right? No one ever asks that question, but that's a very valid question. In fact, if you can answer that, you get to the root cause of the problem. Okay, or if you have a piriformis problem, okay, right here, for example, why is it on the left and not the right? So I'm going to demonstrate that to you. I'm going to have her cross her leg. So go ahead and cross your leg, okay? And I want you to look at the height of the knee. So now take a mental note of that. Now she's going to switch legs, and she's going to do the other one, and this one is lower. So this is lower, that one is higher. So when I see someone like that, you're going to cross your leg, that is telling me that her pelvis is facing left. How do I know that the pelvis is facing left? I'm going to ask her to exaggerate it, and you're going to see it. So I want you to turn your pelvis towards me like that. So now her pelvis is facing left. I'm exaggerating it. Now I want you to cross your leg again. And you can see how now that is a lot higher, right? Now switch sides, and then now that is lower. So that's how I know. Now again, there is an exception to this rule, and the ones that are going to do the opposite are the ones that are what we call spiral line problem, like the one that I previously demonstrated to you. The other thing, so anyway, going back to this, since this is the higher side, the chances of her developing an IT band problem, if I'm going to choose it, it's going to be the right side. Because the ones that move the hip forward, those two muscles are the ones that cross over to compress the IT band. So then it's not written in stone, but that's the likelihood of it developing on the right side is higher. On this side, the one that is likely going to happen, what do you call this, like a hip impingement? No, actually that can also create a hip impingement, but like hip snapping syndrome or snapping hip syndrome, when the hip makes a noise, and sometimes it actually feels like it's going to come out of the socket, so it feels it's going to dislocate, but it's really not dislocating. It's just the snapping hip syndrome is creating. That's usually an iliopsoas problem. So that will likely develop on this side. External snapping hip syndrome is more likely to develop on that side. Again, because that means the muscle that right here is called a TFL. That's the one that's tight, and that's the one that brings the hip forward. I know it's quite confusing, but I just want you to understand that it's, if you take into account the position of your body and the misalignment of your body, when you try to realign the body, you realize that the problems that you think are all bones, you'd be surprised how much better you get. And the best part is, if you address that and realign the body, maybe you don't need surgery, right? Because obviously that's got to be the last resort. So now that I've explained that, let me see if there's anything that I missed. The question is, when you recognize these things, what are you going to do about it? Right? That's the thing, is what are you going to do about it? So we're going to give you at least 4 exercises that could help that. By the way, there's another one that's very common, hip problem, where people will say, you know what, I have pain all the way here. If you have pain all the way here, one thing that I would like you to do is stand in front of a mirror, because that's typically a big part of that is the obliques. So very likely the obliques are going to be tight on that side. I know there are other problems, but again, this really creates the oblique tightness can cause that pain that goes around here. Why? Because this muscle literally starts from here, it starts from here, and it goes all the way here, and it wraps around here, and it goes to the back. So it's a big muscle. So it literally wraps around here. So if that is tight, it could be tugging at the attachment. So it's just like said in the past, if this is your muscle, this one is attached, but this is floating. That's just how muscles are designed. That allows for movement. But if that is tight, it's gonna tug. And if it's going to tug, where is it going to hurt? At the attachment of the scalp. Same concept. So for someone like that, another way to confirm is if you look at your breastbone and you look at your belly button, I want you to check, are they completely aligned? Or does it look like the belly button is slightly off to the side? You're not made that way. It just means that if there is rotation, guess what? The belly button goes with it. So now it's misaligned. So if you work towards realigning it, there's a chance that this will actually improve. There's so many other components, but I just want to give you some tips on what to do, because you're going to find out that even the ones that I've described to you, a lot of times traditional physical therapists have already pointed that out. So it's always like, oh, I know I have my right shoulder is higher. I know my hip is shifted. I get that. The most important question is, what are you going to do about it? Because there is something that you can do about it. And so in our world, that is body recalibration method. And there are 2 ways of recalibrating the body. There is a fascia. When you look at a piece of steak, it's the marbling. And then there is the muscle. And that one, we literally manually move muscles. We're not going to get into that because that does require the skill of a physical therapist. But I'm going to give you 4 exercises that are going to help your hips. So let's start with the first one. All right, so from here, I want you to cross your leg, cross, just like that, like a man, I call it, right? Now, this exercise, you will, if you go on YouTube and search for these types of exercises, a lot of times it will tell you to push this down. I never, ever recommend that. And the reason, it's not that this exercise is not good. It is. The problem is, if you notice, if you force something to stretch, it's going to move at the path of least resistance. And if you have an unstable SI joint, which is the joint that connects the sacrum and the pelvis, it's right there. If you have an unstable joint there, when you push this down, instead of stretching all these tight muscles, you are going to shift that area, and you don't want to do that. So instead of doing that, I want you to lean, but keep your back straight and lean forward. So go ahead and lean forward. And when you do that, you are definitely going to feel the stretch, right? Now, you're going to compare it. You know how I work already. We're always comparing right and left. Now lean forward. And whichever one is the easy one is what you are going to do. So which one is it? That one. So you're going to do that. And then lean forward. We're going to pretend that that's 20 seconds. And you're going to lean back. And then you're going to repeat it. No, on the same side. You're going to do it 20 seconds times 2 on the same side. And remember, that's the good side. I know it's counterintuitive. And then after you do that, you have a choice of doing this one time only or none at all. That's a choice. So that's the exercise. And what it does is it's actually stretching your piriformis muscle, amongst other things. There's still other things that help with that. But if you stretch your piriformis, when you have a rotated pelvis going in this direction, it's going to start, it will help to make it more neutral. So the other one, the opposite of the piriformis is what we call the adductor muscles, right? So that one, I want you to stand up. So this we find is very helpful for people that have pain on the outside. Again, it sounds very counterintuitive that we would be stretching the inner part when in fact the pain is over here. Because we are the people that where it hurts, that's where we're going to stretch, right? That is not the case with this. So what you're going to do, especially if you have hip pain right here, is you are going to take a side step. So I'm going to tip it so that you can see it. Okay, you're going to take a side step, just whatever's comfortable. Don't overstretch it, but you do want it to be wide. And you're going to feel the inside right here. And step in again. Now go to the opposite side and you feel which one is easier, and that's the direction you're going to choose. So in your case, which one is it? Okay, so this is easier. So she's going to step sideways here. You literally stay on both feet. You're not doing much and you stay there 20 seconds. After that, you step back in and you repeat on the same side. Believe me, if you switch on the other side, you just wasted that effort because we're not stretching here. We're just tugging on the fascia. And so again, you can do it twice here. You don't have to do it on the other side, but you also have a choice of doing it on the other side. But remember, the easy side, you do it twice. The tight side, you can only do it once. So that's the other exercise. Now, especially for people who have a hip shift like that, this is a really good exercise, what we're about to show you. So this is the one when you raise your arm like that. And the key here is that the arm is completely straight. The moment you start bending like that, you just broke the line. So you got to keep that arm straight and you're going to try to keep the head closer to your ear. And then the movement occurs right here. So this hand is actually going to try to reach towards the knee. And again, gentle stretch, less is more. Now you're going to switch sides, raise this arm up. And then this one reaches towards the knee. Which one's easier? That one. So that's the easier one. So guess what? That's the one she's going to do, right? So she's going to do that 20 seconds. She puts her arm down, do it again, another 20 seconds. And then after that, you're done, or you have an option of doing the other side. In our clinic, there are times that we will do the good side. There are times, or the bad side, there are times that we don't. I'm not going to go into it, but it's hard for me to correct anything just online. So I just want to give you the option. So that is, again, if you have a hip shift, but you're more than welcome to do that with any other problem. That's going to help your hip. And then the last one is this is for that person that has that pain going in this direction. So you're going to sit down and you're going to cross your arms and keeping your back straight. You're going to twist to the right again gently, and then you're going to twist to the left. And whichever one is easier is what you're going to do. So then you're going to go this way, hold it for 20 seconds, and then go back to midline, and then hold it again for 20 seconds. Then you have the option of doing it one time on the other side or none at all. So that's pretty simple, right? And that should help you. I would love it if you reach out to us, whether it's helping or not. And we're constantly trying to do this, educate people. You will notice that the things that we talk about are not necessarily what you see typically when you're searching for hip problems. And the reason for that is the people don't realize that when they are in pain, they start to compensate, right? And so the compensations create their own problems. And so that's what we're trying to correct is the lopsidedness created by the compensations, because that is your ticket to getting better. So I will sound like a broken record, but if people will say, why is it important to be symmetrical? The best way I can explain it to you is if you think of a car, even if it can run, engine is good, but if the wheels are misaligned, it still won't work properly. That is us. So I hope that helps. We will be seeing you again next month. I would love anybody who wants to know more about a specific topic. Feel free to reach out to us and we would be glad to come up and talk about that specific topic. So thank you for listening. Until next time, if you have any questions or curious about what we do, please reach out to us. We do offer a free discovery visit or a 50% off an actual treatment, but it doesn't have to be that. We can literally be having a conversation on the phone and you will have a better understanding of what is specifically wrong with your own body and your own problem. Thank you.